Our question today comes from Sandy in Washington, D.C. Hi doctor. I am a 52-year-old female with right hallux limitus. 3 months ago I had a chelectomy, right great toe joint with a Cartiva implant. The surgeon also did a soft tissue release of the sesamoids. I have had continued pain in the sesamoid area since surgery. Post-op images at 1 month, while still walking in a rigid bottom post-op shoe, showed the implant appeared to be in good position with decent joint space. 2 months later I still have continued pain with limited ability to bear weight through the sesamoids, and limited ability to dorsiflex the toe with weight bearing. The pain in the first metatarsal phalangeal joint is causing alterations in my gait mechanics, and I am finding myself walking on the outside of my foot. Incidentally, I had an extensive medial meniscus tear with associated medial compartment articular cartilage tear requiring a significant debridement of both 3 weeks prior to the foot surgery. The inability to bear weight through the metatarsal phalangeal joint of the foot is impacting my ability to rehab and strengthen the knee. Plus the altered gait mechanics from the foot pain is putting increased stress on the medial, injured, compartment of the knee. So getting the foot better is even more important because of the impact it is having on the knee. I am attending physical therapy. X-ray at 3 Mohs post-op now shows resorption of the implant and the joint space has significantly decreased. There is talk of maybe needing to redo the implant. Doctor suggested a custom orthotic to possibly help with the sesamoid pain plus allow me to be more aggressive with my knee rehab. I will use the orthotic for at least a month, then we will reevaluate pain and range of motion. They scanned my foot and suggested I get an over-the-counter dancer's pad to use until the orthotic came in. The orthotic has arrived. The orthotic has plate specifications for device width as bisect first metatarsal. The left and right orthotics are made to the same specs, but the left foot is not having any issues. There is no dancer's pad in the orthotic. I have been having sesamoid pain since the surgery but not prior to it. Shouldn't an orthotic for sesamoid pain have a dancer's pad? I have used the orthotic for a couple of days and don't feel like there is any less stress on the sesamoids. Still painful. Over-the-counter dancer's pad helped some but tended to move around on my foot requiring repositioning every few hours. Since this was caused by surgery, would getting a steroid injection soon be reasonable? Also, how common is it to need to redo the Cartiva implant? It's relatively new in the US, only approved in the middle of 2016, but I haven't come across many studies reporting problems with it. Could the hole drilled to set the implant in have been made too deep? Is it because the implant is a little crooked? If I am now almost bone on bone, could that be why I am having pain with dorsiflexion? There is no longer a bone spur in the way, but could it be the actual head of the metatarsal and the prox phalanx are colliding? Thanks in advance for your feedback. Here is my response. Hi Sandy. Let me start off by saying that I have no personal experience with the Cartiva implant, but the exciting feature of this type of implant is that it will create a synthetic or artificial cartilage over the head of the first metatarsal bone, which is something celastic and metal implants cannot do. Celastic implants tend to resorb and break down over time, and metal implants tend to wear down bones simply because metal is harder than bone. Unlike other implants where portions of bone have to be removed, that is not the case with the Cartiva implant. I can see by your 2 X-rays that the joint space has diminished over the period of a few months. I would not be surprised if that is a common finding with this type of implant. The purpose of implants for hallux rigidus is more to reduce pain and less for creating greater range of motion. I have no hard statistics but am willing to bet that most people who have great toe implants really do not end up with a greater range of motion, but in most cases end up with significant reduction in pain, and at the end of the day, that is what most people want. Work was done on your sesamoids in an effort to give you further motion in the great toe joint, and more than likely as a result, that is why you are having sesamoid pain. Even though you did not have blunt trauma to the sesamoids, you did have surgical trauma, and there is always the possibility that there might be a fracture, although more commonly the pain is due to trauma to the ligaments that attach to the sesamoids. An orthotic would be the advisable option here, but based on your narrative I have two issues with your orthotics. 1. They were made narrow by bisecting the first metatarsal, which may give you more flexibility in your shoe selection, but will probably aggravate your tibial, medial, sesamoid, since making the orthotic slightly narrow will probably end up pressing into the tibial sesamoid. 2. A dancer's pad should have been built into the orthotic, as the sole purpose of the orthotic with the use of the dancer's pad is to take weight off the sesamoids. Before you consider a cortisone injection, you want to make sure that one of the sesamoids is not fractured. For that you would need a bone scan or MRI, as a simple X-ray might not show a small sesamoid fracture. Assuming no fracture, a cortisone injection might not be a bad idea. I do not know if I would personally recommend another Cartiva implant. From a surgical standpoint, it is not that big a deal, but if it did not work the first time, what will be different the second time? The views you provided me in the X-ray do not give me enough information to offer any other suggestions. I would be interested in seeing a lateral view, as there are certain issues that may be part of your problem. In summary, my suggestion would be try and get the sesamoid issue in order with a proper orthotic, perhaps a cortisone injection if there is no sesamoid fracture. I would continue with physical therapy in an effort to reduce the pain in the joint. If your surgeon suggests further surgery, definitely get yourself a second opinion. You do not want to fall into the trap of having repeated surgeries on the same joint. Each subsequent surgery creates more scar tissue, which can actually make matters worse in this type of situation. Visit us at www.foot-pain-explained.com for more information.